Good afternoon, everybody. Before I move into the numbers, I just want to take a moment. As y'all know, Medical Center, we did have a employee that passed away last night. And this has been a very emotional day for our staff and for our crew. You know, when you work with people every day and you're in close quarters like some of our crews are, they become your work family, and you probably spend more time with them than you do with your regular family. Having this happen has been a very traumatic experience for our crew. They're doing about as well as anybody could hope to be. Our thoughts and prayers are with this employee's family. The response we've had today through social media and just through phone calls and just the outpour of love and support we've had has been huge. And I want to say thank you to the people of Odessa and Ector County. We've had pictures come in from other hospitals around us that have paused today in a moment of silence in recognition of our employee. And we want to say thank you for that. But no doubt about it, it brings it real. It makes it real when it's in your house and it's knocking on your door. It makes it very real. And our thoughts and prayers are with them, and we appreciate any prayers anybody can give us. And just tonight, when you're with your family, hold on tight, because nobody's guaranteed tomorrow, and life is precious. And we are not going to be the same without this employee, but we know the best thing we can do and what they'd want us to do is to carry on, push on, and make sure our patients are getting the best care they can. At Medical Center today, currently, we have 41 COVID patients in-house. We have 816 that have tested positive. In the hospital, 12 of those are on 7 Central, 14 of those are on 8 Central, 9 on critical care, with 2 of those being on the ventilator. We have 5 patients at Wheatley Stewart. 5 of those are on the ventilators. That's our overflow area. And we actually have one in-house that is in labor and delivery. So that's a new situation for us right now. This includes 6 patients from Sienna Nursing Home and Rehab, 1 from Focus Care from Odessa, 3 from Fort Stockton, 4 from Andrews, and 1 from Stanton. So that's our patient load. 3,268 have tested negative, 356 pending, with no suspects in-house, and a total number of tested 4,440. And I know Kristen's on the phone, and if she wants to add anything, I'll send it to her.
Thank you, Russell, for your kind words about our employee. I just want to echo those sentiments and appreciation for all of those people that have reached out to myself and the members of our hospital staff. I just wanted to give one update regarding pastoral care. We have decided on the importance of having someone in our building rounding on patients from a pastoral standpoint. So beginning next week, we have reached out to churches, and we are going to allow pastoral care in the building with specific PPE on Tuesdays and Thursdays between the hours of 10 and 12, and then again from 4 to 6. That way we can accommodate what our patients are needing, what the staff is asking for to support the patients, and kind of give the community a little bit of support on the inside as well.
Anything
and that's
else,
all
Kristen?
I have.
Okay.
No, that's all I have, Trevor.
Thank you, Kristen. Want to go to Stacy for ORMC update.
Thank you, Trevor. I would certainly like to extend our deepest sympathy to the Medical Center Health System family too. It feels like one of our own because it's our frontline healthcare workers. And so just know that you all are in our thoughts and prayers. If there's anything that we can do for you, please just let us know. Odessa Regional has tested 1,368 individuals. 261 of those are positive, 1,088 are negative, and 19 are pending. We currently have 14 patients in-house. 8 of those are on a ventilator. They're all from the area except one who's from Courtyard. We have had 6 discharges since we talked on Wednesday, but we've had 4 other admissions during that time, and also 1 death of one of our COVID patients as well. So our thoughts and prayers are obviously with that family at this time as well. So that's all I have, Trevor.
Dr. Sheridan.
Just one comment for today. At the hospital, we're going to start doing screening COVID tests for every patient that's admitted and every patient that's having surgery at the hospital. That's going to start between now and next week. We're going to start that process. So anybody that shows up for an admission directly or is being admitted through the ER, anybody that comes in for a surgery, we're going to start doing some screening tests just for an extra level of protection. Obviously, the doctor's offices are already screening patients before they schedule certain cases to make sure that those patients are safe and they have screened negative. But this would be an additional step. So just wanted the community to know about that.
All right, thank you, Dr. Saravanan. We've got Drs. Davenport and Dr. Benton with us as well. Do you guys have anything you'd like to add before we get to media questions?
No, nothing particular from me.
Okay. And Mayor Turner, do you have anything you'd like to address before we get to media?
Sure. On behalf of the city, I would like to extend our deepest sympathies to Medical Center and that entire family. And the family of the victim. Unfortunately, sometimes this gets a little close, and this time it really did. So we pray for all of those that have lost family members, but we're here, and we will be here if you need us at all. Talk a little bit about, there's a lot of rumors going around the city about closing down. We have not seen anything from the governor's office that says we are closing down, and that's not really something that anybody wants. We just got the latest unemployment rate. Right now we are at top of the state at 13%. Some of the others have actually dropped below us a little bit, but we are, that's keeping the economy open is vital for many of these businesses. I went to where I usually get my hair cut. That shop was closed, and a small business called Liz's Linens has also been shut down, and the building was empty. So we're starting to see some of that, and we're very concerned about people not having jobs if we had to close back down. Unfortunately, maybe only one person in the family is working, and to have them restricted on that income would be very scary. But that's all I've got.
Thank you, Mayor Turner. I just got a message from Eddie, Commissioner Shelton. He's been off and on. He's trying to reconnect again, so apologize for that. Russell, you had one more comment before we go to media questions.
I do. I want to just quickly, Mayor has been gracious enough and is donating some Subway gift cards for our employees. And Mayor, we appreciate that. There's one thing hospital employees know how to do, that's eat, that's for sure. And we appreciate your kindness, and I know it'll make these staff make their lives a little easier. They can stop by and pick up a good Subway sandwich. So we appreciate that. And thank you for that.
My pleasure.
I share in that too. Thank you, Mayor Turner. We appreciate it as well.
My pleasure.
All right, let's go to media questions now, and I'm going to bring up Felice from Channel 2.
So we know that you guys already went over this, but a lot of our viewers are still confused on counting cases because the state has decided to not count probable cases now. So we just kind of want to set the record straight, how the county is counting cases, how the state is counting cases, and the correct way to count COVID-19 cases. So Ector County is continuing to report confirmed and probable. That's correct, right?
That's correct.
So what are the qualifications for a case to be considered probable?
Probable cases are people who have symptoms and were tested with an antigen type test instead of a PCR type test. So, and that is an accurate test when it's positive. So it does give us an indication of prevalence of the disease to count both of them.
And why would the state remove probable cases from their case count?
So that the health department contacted the state several weeks back when we had this discussion, and the state chose not to report them because there was not consistency across all of the counties. But the state also said that it's appropriate to count them and report them.
That's all the questions I had.
Thank you, Felice. And next up, looks like it is Mike Merlot, Odessa American.
Hi. Yeah, I was just wondering if the MCH employee who died last night, if that was a nurse, if she was a nurse.
Kristen, are you there? You want to take that one?
Sure. She was not a nurse in our facility, but she is part of our care team and one of our healthcare providers.
Okay. Okay. Did she work on the COVID floor?
We're going to stick to what we've done on all the other employees and not release where she worked.
Okay. All right. Thanks for that. And I guess, one of the things that y'all have talked about before is, the physical health of your employees and the mental health of your employees. Is there some sort of counseling available for, coworkers having to deal with, I guess, the loss of a coworker or friend?
Absolutely. Last night at the hospital, we do a thing for our veterans called an honor walk. We included this employee in that last night, and we lined the halls to honor this individual. We have pastoral staff that have been scheduled to come up last night as well as through today and in future days to speak with the staff. Myself and a couple of other people have held some little prayer groups, and we have an employee assistance program through the hospital's human resource department. So they are on standby, and they're going to come through for sessions as well, so that we have that for these individuals. But as we continue to go through COVID, we know how tasking it is. So we actually have a care support team working to set up debrief sessions throughout the organization on a weekly basis so that any of our employees, even if it's not during the loss of one of our own, can go and just kind of talk through the stresses of work.
Okay. And that's good to hear. As far as those temporary contracts, Kristen, have many people applied for those positions that you're looking for at MCH?
Yes, actually we have hired 4. We had 2 that are interested. They just have not put their applications in yet. But in the first 24 hours of post our announcement, we did hire 4 individuals.
Okay. And I guess as far as those 4 people, why would they want to do this right now? Has it been difficult to recruit healthcare workers at such a stressful time?
No, I think healthcare workers in general want to help. We are still recruiting nursing students that are graduating from school, people moving into our area. We're just needing them at a more rapid pace than what we have in the past. And if you talk to any of these individuals that have put in applications to become temp employees for those 10 to 12 week contracts, they all have said, we absolutely will work on a COVID floor. We'll work anywhere you want us to work because we just want to help. We know that the need is there. So these are just individuals that really want to do a good thing. I'm sure money is a little factor because they want to make some extra. Several of these are coming from other communities surrounding Odessa, and they work 7 on, 7 off, and so they want to help while they have some downtime.
Okay, so there is some I guess, financial incentive to also to work, not just helping out the community.
Absolutely. I mean, I think everybody works for a paycheck, and
Right.
that's just kind of what they're doing is they know they're going to get paid, but they also want to help, and they don't want to just sit at home when they know that they could do some good and make money at the same time.
Okay.
Hey, Mike, one thing I was going to tell you, every hospital in the world is looking for nurses or healthcare workers. We went through the JRAC and through the trauma through the state to get on a list for where they can send you workers. And we called, and Baylor Scott and White was on the call as well. They were asking for 800 nurses, LVNs, CNAs, 800 of those. And so the pool, suddenly now everybody's trying to get into the same employment pool to attract the same kind of employees. And when you have a system the size of Baylor Scott and White telling these people we were on the phone with, they need 800 of those, you start to realize how thin that pool gets in a hurry. It gets really shallow.
Right. Well, thanks for that. And I guess the state is giving nursing home tests. Is anyone aware if some of those tests are coming here? No.
I haven't heard anything.
Okay.
I'm not aware of any, Michael.
All right. Thank you. And I guess for the medical professionals, this will be my last question. How do y'all feel about schools reopening? Is there any thought process to that right now? And I guess your preferences of where our numbers are at right now, and then predictions, I guess.
I've got a 15 and a 16-year-old. We had this conversation a couple of nights ago. They want to go back to school.
Right.
I mean, and so I don't just think it's the parents and the kids. You got to look about how safe it is. You look at what ECISD is doing with, they've ordered like 900,000 masks. They've got all kinds of safety places, protocols in place. And ultimately, it's up to the parents to educate their kids about keeping their mask on and washing their hands. But at the same time, that helps protect the educators as well. So it's got to be safety first. And I applaud the local school districts and what they've done they started planning for this a long time ago, and it seems like they've got a good jump start on it.
Michael, there will be an announcement. Scott, the superintendent, is going to announce Tuesday night what they will be doing, and then they will roll it out to the public on Wednesday. I spoke to him yesterday.
Okay, thanks, Mayor. And Dr. Saravanan, do you have any thoughts on that?
Yeah, I think one of you guys had asked this before, and I absolutely think that it's a difficult subject to talk about because as healthcare professionals, as doctors, we definitely know the importance of kids being in school and in person. There's so many different levels of repercussions to not having kids in school. So we are a huge supporter of getting the kids back in school. We just have to do it in a safe manner. And there is safe ways to get kids back into school. It's very dependent on where your community is currently with the disease process and whether or not you have the resources to keep everybody safe, not just the kids and the teachers, but the people that they're going home to at the end of the day when there is widespread community spread of the disease process. So there are AAP, American Academy of Pediatric guidelines out there. There's also a lot of guidance documents that school systems have already gotten, including our own. We've gotten a lot of guidance documents from the state. So there is a way to do it. It's just not going to be the same as it was before. So if I can compare it to something, let me compare it to our reopening of Texas, right? Reopening of our economy. I want to caution all of us that yes, we want our economy to open back up, but we have to do it safely. It shouldn't have gone from shut down to full-on opening. Similarly, for the schools, yes, we want the schools to reopen. We just have to do it safely. It has to be staged. It probably has to be well planned, and it has to be a community effort. Everybody has to agree to abide by this plan so that it doesn't get out of control when we have community spread in the area.
Thank you, Doctor. And that's all I have. So thank you, Trevor.
All right, thank you, Mike. Up next, looks like I've got Danny. Do you have anything?
Can you hear me?
Yes, sir.
All right. With the schools reopening in August, do you think that August is too soon? Maybe push it back to September to make planning a little bit better? Anyone?
Danny, you've watched this change in a short period of time. 2 weeks ago, 4 weeks ago, we were in a different situation than we are now. There are some predictions we can make for what it'll look like 4 weeks from now, but you're asking for that prediction again, and it's hard to do at this time. We just have to have the contingency plans for 4 weeks from now, depending on where we are as a community in this disease process. So let's say we are still rampant, very high positivity rate, 15 to 20% positivity rate. Let's say we are having a lot more people still coming into the hospital and our census is growing rather than coming down. Let's say there's several hundred new cases coming on each day. Well, the answer will be different than if it was a lot less than that. If our positivity rate drops under 10%, if our case counts start to decline, that means we're having less number of new cases every day for a period of about a week to 10 days, then that would be a different answer. So the first answer would be no, it wouldn't be a good time to open schools. We should delay it maybe 3 or 4 weeks and then reassess. And the second answer would be, okay, we can start to do the staged reopening where there's only a certain amount of people that are in the schools at a time, that the desks are 3 to 6 feet apart, that the kids are not facing each other but facing away from each other, that there is certain rules and regs in place for how they would do gym class, how they would do it outside rather than inside, those kind of things. So it's a much more complicated answer of when you're going to go through and do the staged reopening, but the simple answer is we can't answer 4 weeks from now what we should do, but we should have plans for either or.
Okay, I'm good. Thank you.
Thank you, Danny. Up next is Scott.
Hey, everybody. Russell and Kristen and Trevor and the doctors, words ring hollow sometimes, but I just wanted to let you know that we here at the TV station are thinking about you guys, and we truly appreciate you taking the 20, 30 minutes every other day in the middle of a crisis to keep us up to date on what's going on. And I know it's what you signed up to do, but I don't know that you signed up to do this all day, every day for month after month. And I know it's hard to get off the hamster wheel sometimes. So we appreciate all the hard work you guys are doing to keep us healthy and keep us safe. And Stacy, we just wanted to also say congratulations on your new assignment in Big Spring. That's all I've got.
Thank you very much, Scott.
Thank you.
Thank you, Scott. Appreciate that. Looks like I know there's a couple others in here. Let's see. Violet, do you have any questions, Violet?
No, Trevor, thank you.
Okay, and I believe I saw Tatum in there as well. So Tatum, did you have any questions?
Hi, yes, I do. Okay, so Russell, I heard you say that y'all had one patient in-house that's in labor and delivery. What are the protocols for that? What does that look like for that patient? When it comes time for having the baby, what happens from there?
Let me turn that over to a nurse that's also a mama and can talk about having babies. Kristen?
Sure.
So we do the same procedures. Everything is, we have all of our PPE covered for those individuals. In the event this mother went into labor, there's limited people in that room. The baby's put into an isolate, and we take that baby to the NICU into an isolation room as well. So all the proper processes we've aligned for non-pregnant patients, we do it exactly the same.
And so I've gotten a few questions from viewers saying that, you know, if say you're just pregnant in general and you're getting ready to having that birthing plan, before they come in, do they have to take a COVID test and say that the mother does test positive? Are they not able to see the baby at all until they test negative? What is that? How does that work?
So every facility kind of has their own plan. You have to assume that the mom is negative, and you want to make sure, not assume they're negative, I'm sorry, that if mom is positive, then baby's going to be around mom. So we really try to balance those situations to where if mom is symptomatic, is she asymptomatic? That way we're not keeping them apart for 14, 28 days, because that's not ideal either. So we really kind of look at the symptoms and as to what the baby's physician really recommends in regards to how the baby's progressing, because we don't want the infant unduly exposed, but we don't want to keep them apart either.
Or would you say it's a case-by-case basis? You know, we'll just monitor
I
each
do.
one as you go?
I do. I would say case by case, and every facility is going to respond a little bit different.
Tatum, I can probably add a little bit to that conversation.
Please do.
There's 3 different organizations that really make recommendations on how to handle the mother-baby relationship as it relates to COVID, and how to go through that delivery process and the recovery process thereafter. One is the Academy of Pediatrics, another is Society of Maternal Fetal Medicine, and the third is the ACOG, the Association of OBGYNs. So the 3 usually recommend exactly what Kristen said, which is you're trying to prevent the baby from getting sick when they're very, very young, when they're an infant, when they're tiny, when they're small, when they're most vulnerable. You're trying to get them, you're trying to prevent them from getting sick from a mom who is actively COVID positive and shedding virus. And remember, this is a respiratory infection, so the way that the baby's going to get it is through the respiratory droplets from mom. There is one type of transmission called vertical transmission that's going through the placenta when the baby and mom are connected, to see if it went through the blood into the baby. And to rule that out, what we do is we do an initial 24 or 48 hour test on the baby as long as the baby has been separate from mom. That test proves that there was no vertical transmission. We haven't seen a whole lot of that. It doesn't go through as much. But there are protocols in place of if a mom says, no, I really want to have the baby with me, I really want skin to skin time, I really want to breastfeed directly. Remember, we encourage pumping, and we did still encourage breast milk, but we still think that the separation is the safest option, because you don't know how an infant yet is going to react to getting this virus from mom. So although we recommend the separation, the option to co-room with the baby is a joint decision between the doctors and the patient. It's never one person's decision. It's not a rule. It's more of a, here's my recommendation. You're asking me as a consultant for you, here's my professional opinion. Now let's have a conversation and let's weigh the risks and benefits and see which one is best to do. So if a mom shows up and says, we absolutely want to have the baby co-room, then we put the mom and the baby together in an isolation room. We put a physical barrier between mom and baby. We try to put a 6-foot distance between mom and baby. We make sure the mom wears a mask whenever the baby's being handled. We make sure there's good hand hygiene happening prior to breastfeeding. So those are the different precautions you can take to decrease the possibility of mom giving baby the infection through respiratory droplets. Obviously, if we do the separation, that's our standard procedure, which we would say, hey, let the baby go to the isolation room in the NICU, let the mom stay in an isolation room by herself, 24 to 48 hours. We test the baby. As long as baby is negative and there's no vertical transmission, then we give the advice to the mom of how to handle her baby at home for the next 2 weeks or so. And then we call the pediatrician who's going to be taking care of the baby, tell them what is the 7-day visit going to look like, what's the 14-day visit going to look like, what PPE do you need, and when can you clear the baby and the mom to really be fully together without all those extra precautions. So we go through through that entire process. So long answer for what you asked, but it is a case by case based on what the parent wants and what's the safest option that the doctors can explain to the patient.
Sure. No, I appreciate that. We've gotten a few questions and I've never known how to answer that one. So thank you. Dr. Sarabanan or Dr. Benton, I'm curious to what your response would be to this. So I was looking at the data today from the county, and it shows that we're hovering around a 15% positivity rate right now. When the average person looks at that, how should they interpret that number? Is that really high for us? Is that low? Is that where we should be, want to be? What would you tell that person about positivity rate?
So yeah, that I don't know how to answer the question where we should be. We would hope it would be smaller, but that does give us some indication of kind of burden of the disease or prevalence within the community. The interesting thing about that graph, though, is it's a weekly graph, so it's not necessarily always exactly real time. And actually, if you look at the daily new case graph or the epidemiologic curve, the daily new case graph is trending down. So new cases per day are down. So our positivity rate could be different next week. But in general, it's a significant number to be 15% positivity rate.
Tatum, I can add a little bit more to that. So the word positivity rate means if you do 100 tests, how many people turn out positive? And that number is 15, right? So that's the first interpretation. The second is, what is it supposed to be, and is it considered high or low? One of the metrics we could use is a nationally accepted standard of what we consider possibly as a hot zone. Somebody who has an area that has a positivity rate greater than 10%, usually can be accepted as being a hot zone or a place in which there's a lot going on with regard to that disease. So 15 is qualifying us as a hot zone. Hopefully, if we drop under 10, that'll make us get to a better, as Dr. Benton said, it's a rolling 7-day average. So we won't see the change for a period of time, but at least we know it's going in the right direction if it drops below 10.
Thank you. Mayor Turner, this one's for you. I heard you saying that our unemployment rate's hovering around 13%, if I heard that right. As the mayor, what do you do with that information, and how do you keep people encouraged that this will? I don't even know what you would even say to people about having that high of a unemployment rate right now, especially when just a few months ago we had one of the lowest in the state.
Exactly. Last month this is actually a month behind because that's how they trend. This is how they track. So back in May, we had an unemployment rate of 16.5%. So we were actually seeing a decrease down to 13%. But you made a very good point. We had one of the lowest. And now, right now, as of June, we have the highest unemployment rate in the state of Texas. We've had more or less a double impact here with lower oil prices and COVID. And we're starting to see people actually being able to go back to work, which is fantastic. We just want to be able to do what we need to as a community to get the COVID numbers down so we can leave everything open. Because the worst thing that would happen here is start to, see things close down. You're going to devastate a lot of businesses. There are a lot of businesses that are barely hanging on at 50% occupancy. We need to be able to move forward, but we have to take care of COVID first.
Thank you. That's all I have.
Thank you, Tatum. And I think that is it. Does anybody else have any questions they'd like to ask that I might have skipped over here in the participant list? All right, I think that's good. Russell, do you want to close us out as we head to the weekend before we reconvene on Monday?
Just want to tell everybody have a good weekend. Be safe. Wear your mask. Wash your hands. And be careful out there. Still a lot of people out there. Just be safe. Take care of yourself. Mark 9:23 says, and Jesus said, everything is possible for one who believes. Have a good weekend.